Hi, it's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in a series of questions from my client Steve. And the question last week was part 5 of my 73-year-old mum had a stroke and is intubated in intensive care. She can't come off the ventilator and the breathing tube. Can she have a tracheostomy and go home and have intensive care at home? And again, that was part 5 of a series of questions from one of my clients, Steve. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Have Answered, I want to answer another question from one of my clients, Veronica, which are excerpts from phone and email counseling and consulting sessions with me. And the question this week is part 1 of my 71-year-old dad is in ICU with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? And again, that's part 1 this week. So, Veronica writes, Hi Patrick, my dad is 71. He's in intensive care, and last night we, meaning my Mum, me and my brother, were asked by the ICU doctors to decide if Dad deteriorated further, if we wanted to opt the option to make him comfortable and he may not have made it through the night, or option 2, let the doctors put him into an induced coma and on the ventilator and respirator. We choose option 2, which is where he's now, and I'm so scared that my dad, at his age, and with his complications, that he was admitted into hospital 8 days ago with lung cancer stage 4, complications with fever and infection and pneumonia. He has now been on treatment for his cancer for the last 2 years, and he has now rapidly deteriorated since admission to hospital after they did a bronchoscopy on his day 2 of admission. Since Dad's been in hospital, he's had further complications like infection, virus, pulmonary edema, and a stroke. Any advice would be very much welcome from Veronica. And if you're watching this and you want one-on-one consulting or counseling with me, just click on the top of the website where it says one-on-one counseling and consulting. Click on the link and select from the options that work best for you. So here is my response to Veronica. Hi Veronica. Thank you for sharing more about your dad's situation, and thank you for being a client and using my one-on-one phone and email counseling and consulting service. I really appreciate it. A few more questions that need to be answered to get further clarification about your dad's situation. So, have you or other family members ever discussed with your dad what he would want in such a situation? Does he even have an advanced care directive? Also, are you his medical power of attorney or next of kin, and do you have any decision-making authority? Next, do you know if he's on any inotropes or vasopressors? Inotropes or vasopressors are intravenous medications such as adrenaline, noradrenaline, milrinone, dobutamine, etc., given for low blood pressure, and they are considered life support and therefore can only be given in intensive care or critical care under monitoring. Next, what cancer treatment was your dad on? For example, chemotherapy, radiotherapy, or did he even have surgery for the cancer? Also, you mentioned your dad had a bronchoscopy. The question that I have is, did your dad deteriorate after the bronchoscopy? And do you know if it was a factor of the deterioration, especially since you mentioned your dad has a pneumonia now? Next, With your dad's pulmonary edema, have they given you a reason why? Do you know if he also has a weak heart, or do you know if he has kidney failure? Both might lead to pulmonary edema. You also mentioned that your dad had a stroke. When did he have the stroke? This week? If he's had a stroke, they must have done a CT or MRI of the brain. And if so, do you know the results of the either CT brain or MRI of the brain? I hope my questions don't overwhelm you, but the devil is in the detail. And the more information, the better, and the better advice I can provide. I know this is a complex situation, but that's what most situations in intensive care or critical care look like. And I will need to break it down for you so that you understand what's really going on and how you can manage it. And here is Veronica's response now. Veronica says, "Hi Patrick, thank you for your reply. My father is being given noradrenaline because he has low blood pressure, the nurse just told me. Yes, we have discussed this situation briefly, and I am his power of attorney as his daughter. He has given instructions years ago about his advanced care directive to Mum and myself. My father was having chemotherapy, then immunotherapy, and then back to chemotherapy. He had his cancer diagnosed in October 2014 and had his right lower lobe of his lung removed in February 2015. He was on his third line of treatment awaiting another trial drug due to be available around May. Yes, I do believe that he deteriorated after the bronchoscopy. It was meant to be quick, and he has been in intensive care since, and the pulmonary edema occurred the day after the bronchoscopy, and then they said he has a weak heart at about 35% ejection fraction. He was never told about his weak heart before. Even the ICU doctor said they didn't know this. He suffered a stroke in ICU on Thursday morning. His cancer specialist said it happened because they were withholding the blood thinners after the bronchoscopy. They then also said he looks like he would make a near complete recovery from his stroke the day of it and after it, because he retained the strength in his arms and legs. The left side was affected. His left side of face and his swallowing and talking is the issue. So yesterday they put him on a feeding tube at 1 p.m. and he went downhill fast after they inserted the feeding tube and went downhill fast after with a fever and a new infection. I saw my dad just now and we are waiting for the CT scan results of his head. They did test this morning. I will request copies of this test as well. Thank you for your thoughts and your time, from Veronica." So, here is my response. Hi Veronica, thank you for your reply. With your dad having given advanced care directives to you and your mum, what are those directives? Are they clear for intensive care or critical care treatment? Sometimes it's very difficult to give advanced care directives for situations that may or may not occur in intensive care, because at the end of the day, you don't know what you don't know. Also, even though a health professional might explain procedures, treatment, etc. in intensive care for you, unless you have seen it many times, you don't really know what it means. It's really important to understand the pros and cons of all of the options laid out to you. As you can probably see by now already, most questions that arise when being treated in intensive care or critical care are not simple yes and no answers, but they require an evaluation of a much bigger picture. Next, here are my thoughts with the information you have given me thus far. I definitely believe that you have made the right decision by putting your dad into an induced coma and on a ventilator. simply because you want your dad in a position where you have a say what might happen next. If they had stopped treating him yesterday, you would have lost control immediately. If I was you, I would wait for the CT brain results and make every decision from there. If his heart is quote-unquote only functioning at 35%, they would be referring to his ejection fraction, which is how strong the heart is beating. If it's 35%, it's fairly weak, and I'm not surprised he went into pulmonary edema. A weak heart is unable to cope with all the fluids going through the heart. Therefore, the heart is decompensating, and fluids are pushing into the lungs, hence pulmonary edema, also known as water in the lungs. Also, as far as the infection is concerned, it's probably a side effect from the chemotherapy or radiotherapy. I would also be asking for his white cell count and his neutrophil count. I would also suggest that we get on the phone as soon as possible, as we are just scratching the surface here. As you know, I have worked in intensive care for nearly 20 years, and you simply don't know what you don't know. I can quote-unquote handhold and guide you through this once-in-a-lifetime experience that you simply can't afford to get wrong. As you know, I can help you with asking all the right questions so that you are always in a position to make informed decisions, get peace of mind, stay in control, and keep your power and influence at all times. Keep in mind that the intensive care team is managing families of critically ill patients 7 days a week and 365 days a year, and they know what to say, they know how to say it, and they also know what not to say. There is a lot at stake on your end as well, as from the ICU end too. You want and need to get the best outcome for your dad, and the ICU simply wants to limit expenses and keep the stay in ICU as short as possible. Keeping the ICU stay short might also mean pushing for an early withdrawal of treatment, which could ultimately lead to your dad dying in a time frame that doesn't align with your goals and with your time frames. By getting your dad into an induced coma on a ventilator and on inotropes or vasopressors for his weak heart, you have bought him precious time to see if he can recover or not. Yes, stage 4 lung cancer is most likely life-limiting, but you don't know how much time he's got left, and by buying him this precious time, you can give him more time. Being aware of those dynamics is important, and it helps you getting bargaining power in what you want for your dad. Best wishes from Patrick. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly, whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find international phone numbers on the top of the website. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone and via email by clicking on the products tab on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.